Thanks so much for joining us for today's presentation, Making Epidemiology Engaging and Relevant for New Learners. My name is David Diadana, and I'm the Senior Editor and Content Strategist responsible for the Public Health and Health Administration publishing programs at Springer Publishing, an independent publisher known for innovative textbooks, professional references, and clinical products in the fields of nursing, behavioral and health sciences, and medicine. Before I introduce the presenters, please note that this webinar will be recorded, disseminated, and posted on our website 5 to 7 days post-event in case you miss any part of the presentation. If you have any questions, please type them in the Q&A box on your Zoom control panel, and we can address those at the end of the presentation. And if you forget to ask a question, there will be a brief survey sent at the end of the webinar, and you can include your question there. We will greatly appreciate all your questions and feedback. I am delighted to introduce our speakers for today's presentation. Dr. Lauren Christiansen-Lindquist and Dr. Kristen Wall are both faculty with Emory University's Rollins School of Public Health in the Department of Epidemiology. They have a combined 20 years experience teaching epidemiology and have taught students across different education levels, from undergraduate to advanced doctoral students. Together, they teach a foundational epidemiology course for undergraduates at Emory College, and they are co-authors of the new textbook, Fundamentals of Epidemiology. And now I'm pleased to turn it over to Lauren and Kristen.
Great, thank you for that introduction, David. Welcome all, thank you for taking the time with us today. As we think about this question, what is epidemiology? I think most of us really first turn to that formal definition, thinking about the study of the distribution and determinants of the health-related states or events in populations. But Kristen and I really think that epidemiology is so much more than that. Yes, these are tools that we use to improve the health of populations, but we also think that epidemiology provides a framework for critical thinking that is really essential for everyone to be an informed member of society. And as you heard, we teach students from undergraduates all the way through advanced doctoral students. Today's presentation is really thinking about those early learners. And while we would love to train a whole army of epidemiologists, we know that many of them will not go on to study epidemiology. And yet we think that the skills provided by and critical thinking that epidemiology affords are really critical for them. And so we think it's really important to keep them engaged in this course so that they can carry those skills with them as they move forward. So as we're thinking about these new learners of epidemiology, who are they? We certainly see learners across the age spectrum, but as the group that we're really focusing on today are those early learners who want to think about who are they. So in 2020, those who pursued degrees in STEM, half of them were women and 42% of them were people of color. We see those same sort of trends in epidemiology as well. This group really is, but it's really Gen Z that we're really talking to here. Sometimes you'll hear them referred to as Zoomers. Those are individuals born between 1997 and 2012. This group is more racially and ethnically diverse than any previous generation. They're digital natives. They have no memory of the world before smartphones. And so technology is really important as they're thinking about their learning. And of course, they've all also lived through a global pandemic. This group has a particular deep-seated interest in rooting out health inequities. And of course, that's at the heart of the work that we do in epidemiology. And so as we think about how to engage them, linking the work that we do to addressing health inequities is really important. So as we think about how to make learning engaging for new learners of epidemiology and really wanting to make sure that it's relevant, there are 3 themes that we're going to discuss with you today. The first relates to selection of topics that are relevant and of interest to students, but specifically are linked to public health action. How can we use the tools in epidemiology to make people's lives better and healthier? We know that our students are bombarded with more information now than ever. And so how can we think about using epidemiology as a framework for understanding and sort of decoding misinformation in the media? And finally, we'll touch on the use of artificial intelligence as a teaching tool. It's clear that our AI is here to stay, and we're going to think about how can we incorporate this to be keeping our students really engaged in their learning. So at this time, I'll go ahead and turn it over to Kristin, who will talk with us a little bit about the Flint water crisis and how we can use this example to help link epidemiologic concepts to public health action.
Thank you, Lauren. So as Lauren said, I will begin with this example of the Flint water crisis, which integrates many of the themes that Lauren just mentioned and is probably familiar to many of you just because of exposure from the media. So I'll kind of begin with the story. So in about 2014, the residents of Flint, Michigan began voicing concerns about water quality. They were concerned with water color, taste, and smell, and then they were also reporting an increased incidence in skin rashes. And around this time, a pediatrician in Flint, her name's Dr. Mona Hada Atisha, she's a first-generation Iraqi immigrant, began observing elevated blood lead levels in children, in her patients. And based on these observations and these descriptive data, she ended up conducting an analytic epidemiologic study that ultimately found much higher blood lead levels in children after Flint had changed its water source. And we'll look at those data in just a minute. So this type of epidemiologic story, as I'm kind of calling it, which begins with observations and findings from descriptive studies, and generally observations of something potentially unexpected, and then leads to hypothesis testing with analytic epidemiology, can serve as a strong motivating example for students, in which we can sort of move through the entire cycle of analytic epidemiology. And specifically the types of examples where we can start with human stories and take it all the way through analytic epidemiology, talking about study designs, measures of frequency, association, but all the way through actual public health impact, where we're able to talk with our students about disseminating results, seeing impact in public health, is really motivating for today's students who are often very interested in, topics of social justice. So continuing on with this example, ultimately, Dr. Hannah Atisha published her findings showing a much higher blood lead levels in children after Flint changed its water source supply from Lake Huron to the Flint River. The figure we're showing here shows the prevalence of elevated blood lead levels in children on the y-axis before, that's the blue bars, versus after, that's the red bars, the water source change. And it also shows that specific areas of the city were disproportionately affected. And her data also showed that Black residents of Flint, Michigan were disproportionately affected by the water crisis. And I think examples like this are unfortunately common and very key to provide critical discussion points that our students today are demanding to have, rightfully so, about the effects of things like racism, structural, inequities, and, even sexism, other social determinants of health. And so, many of you are maybe based in academic institutions at many public health schools around the country, including at Emory. Instructors are being encouraged to do some needed preparatory work to have these conversations with today's students. And that can be things like implicit bias training, sensitivity training. But we see now more than ever that these conversations are coming up in our classes, and I think that's a good thing. And it could take some training to be prepared to do that. I also think a really important part of this story, and not an uncommon kind of story, and we'll talk more about some examples that are similar to this in a way. Dr. Hannah Atisha's findings were initially met with skepticism. In fact, the state of Michigan initially tried to discredit her and her work, and they accused her of causing panic. And, despite this, She continued publicizing her work, and the state ultimately acknowledged the water-lead crisis and began to take public health action. And Dr. Hannah Atisha and others are still, even today, very strong public health advocates who are using data from descriptive epidemiology, from analytic epidemiology to to make change, and primarily in her line of work, to decrease the persistent health disparities affecting Flint's children. So I'd like to switch gears a little bit to the different but related topic, honestly, of using epidemiology and epidemiologic methods as a framework to identify and understand media, very often social media, misinformation. So as Lauren mentioned, students today are more inundated than ever with health-related messaging, largely through social media. And unfortunately, health-related misinformation is really everywhere. And levels of health information have really exploded, I think, as most people know, since the pandemic. So for example, there was a recent article in JAMA that was discussing how misinformation about COVID vaccines causing infertility was leading to vaccine hesitancy. And many public health agencies are actively trying to combat misinformation in social media and in other platforms. So for example, we see here that the WHO, the World Health Organization, has created an informatic discouraging people from ingesting bleach or other disinfectants as a way to prevent or treat COVID-19. So Lauren and I both believe that teaching epidemiology provides us with a really excellent opportunity to link fundamental principles to the critical evaluation of public health information, whether that be in the peer-reviewed literature or on social media. So this slide provides a non-exhaustive list of some ways that we can think about this, and that how we can start thinking about interrogating what we see on social media using epidemiologic principles. So for example, considering the source, we often teach concepts to our students about looking for, looking at journal quality, thinking about peer review criteria, thinking about, predatory journals. And we can similarly encourage our students to consider the credibility and objectivity of the social media sources that they are looking at or being exposed to for public health information. Certainly reading beyond the headlines to understand whether the findings and the claims that they're being presented with are based on data at all, first of all. And then considering whether those data come from primary or secondary sources, and we're giving them the tools to really, explore that literature and also other relevant literature that might support or refute the claims that they're seeing. And then certainly considering bias. And I think this is so important. Epidemiology, as Lauren mentioned, provides this critical foundation that is, just foundational for critical thinking in general. So when I'm thinking about bias, I mean, certainly considering our implicit biases, but in my experience, when we teach our students about systematic error, that can be confounding, selection bias, information bias, it really opens up their eyes to be able to critically interrogate, again, not just the peer-reviewed literature, but also all of this public health information that, all of us are sort of inundated with. So regarding this last bullet about reviewing the literature and scientific evolution, I wanted to say a little bit more about that, and about this idea of remaining open to changing your position or opinion based on data and data that evolve over time. So Dr. Hannah Atisha is far from the only scientist to have had their work discredited and then ultimately accepted. This is not an uncommon story throughout kind of the history of epidemiology. And it's the type of sort of human story that I think is motivating. Again, it gives us an opportunity to talk about different epidemiologic concepts and link it all the way through to public health action and impact. So, for example, in the mid-1800s, John Snow, who many people know as one of the founders of epidemiology, noted that cholera patients' symptoms were more likely to be digestive, and he hypothesized that the disease was waterborne. And prior to this, it was thought and generally accepted that cholera was transmitted via the air. And many doctors and scientists at the time were resistant to Snow's work, which ultimately did indeed provide strong support that cholera is a waterborne disease. As another example, Edward Jenner conducted work in the late 1700s on inoculation to prevent smallpox. And many people at the time ridiculed his methods, where he was basically using cowpox material to inoculate people against smallpox. And in fact, he was unable to publish his findings and ended up self-publishing this work. But as again, most people know today, these advancements set the stage for our understanding of immunity and vaccination, and ultimately for smallpox eradication. And we have a more recent example of Katalin Karikó, who is a scientist from Hungary. She moved from Hungary to the United States in the mid-1980s to continue her research on messenger RNA, mRNA vaccines. And during her career, maybe some people don't know this story, she really struggled to get support for her work. She was told that it was not a promising line of research. She had a hard time getting funding, but she persisted for many years, for decades. And ultimately, she and a collaborator, Dr. Drew Weissman, discovered how to use synthetic mRNA to create specific immune responses, which is the basis for the mRNA vaccines that were so incredibly effective at combating the COVID-19 pandemic. And in 2023, Dr. Karikó and Weissman were honored with the Nobel Prize in Physiology and Medicine for this, truly groundbreaking work. So I think these types of stories provide some nice linkages between the techniques that we've started discussing around engaging new learners of epidemiologic methods across ideas about motivating examples with these human stories, linking data to real-world public health impact, discussing social determinants of health, and certainly this idea of being able to critically evaluate data and the public health information, the health information that is coming at us, and being able to reevaluate our opinions and change our position as new data emerge.
Thanks, Kristin. So I will close us out here with a little bit of a discussion about artificial intelligence in the classroom. And sort of regardless of what you feel about it, I think we all have to accept that AI is here to stay. It is evolving rapidly, and our students are using it all the time. And so for these reasons, we have taken the approach of sort of leaning into using AI in the classroom, not just to teach epidemiologic concepts, which of course we can do, but also to help illustrate the limitations of artificial intelligence. And this is sort of circling back to that critical thinking framework that we were talking about before, to help students see that maybe this is a great tool that we can leverage, and we also may need to be skeptical about some of the outputs. So here is an example where I've asked ChatGPT to explain why a cohort needs to start with an at-risk population. And while this response correctly highlights that it's important to use an at-risk population so that we can establish the temporal sequence between the exposure and the outcome, we have to know that the exposure came before the outcome in order for that relationship to have been causal. It generates some other things that are suspect, including questions about generalizability, selection bias, and things related to power and sample size. One of the things that I think is useful to see here is that we can talk through this with students and explain to them why some of these things may be suspect, that issues of generalizability and selection bias are sort of tangential to this issue of starting with an at-risk population, but not central to the question, and that it really doesn't have anything to do with power or statistical inference. And so we can go into some conversations with students to help them understand that while there is some correct information here, there are some other things that aren't quite right mixed in. We can also highlight that this response really misses the opportunity to describe that the use of an at-risk group in a cohort design allows us to study the incidence of health outcomes. And this can sort of lead us to a conversation with our students, again, about the difference between incidence and prevalence. And we can hopefully use this to sort of solidify those concepts in their mind. This is another example here, asking ChatGPT to explain the difference between clinical significance and statistical significance. And while it correctly indicates that these measure different aspects of a result, it erroneously includes a pretty common misconception that statistical significance determines whether an observed effect is likely to have occurred by chance. So again, we can use this as a springboard for further discussion with our students about how do we differentiate between clinical and statistical significance? How can we clarify our understanding of each of these? And then again, underscore the fact that artificial intelligence doesn't always get it right. So the final example that I have here for you, I've asked ChatGPT to generate a description for a case control study designed to evaluate the association between COVID-19 as our exposure and autoimmune conditions as our outcome. One of the things that I like to do in the classroom is also choose examples to help teach some public health lessons to students along the way. One of those is about not writing down playground slides with kids in your lab, or thinking about the failure rates of different types of contraceptive methods. Here, wanting to highlight that although many people think that COVID is over, it unfortunately still is around and can have pretty severe long-term consequences. And so this, using this example sort of affords the opportunity to wrap that into the conversation with our students. But also we've generated a description here, and we can use this to ask students some other questions. We might pick out certain elements of the description and ask students why that was included. If we had generated a cohort design, for example, there might be some sort of descriptive words that would help us understand that they were using an at-risk population. And we could ask students sort of about that. Why did they do that? To help them link whatever the language is that AI has generated to that phrase at risk that they have learned about in class. Sort of some other probing questions that we could use on the basis of this study description here is this description, it tells us, we would find cases and controls, which is great, but maybe we want our students to pause and think a little bit more about that and wonder, how might we identify cases and controls? You might have talked to them about the difference between primary and secondary based case control designs, and we can ask them to come up with two different methods of case and control selection, one that would fall under that primary base umbrella, while the other would be under secondary base. Here, the study description lists out some potential confounders that the investigators might include in this kind of study, but they're just sort of stated out there, and there's no critical thought about whether these actually plausibly could confound the association. So we could lean back on the a priori criteria that we would have taught to students when we learned about confounding and say, given, the a priori criteria, given the exposure and outcome pairing that we're talking about, are these factors that AI has pulled out, are they likely to meet the a priori criteria? Maybe they can identify factors that have erroneously been included that maybe shouldn't be included as a confounder because they're on that causal pathway, for example. So rather than just taking the description at face value, we can pose some additional questions to help them think more and tie this back to things that they've already learned. The study description describes different ways that the study investigators could ascertain the exposure data. So they might collect exposure data using medical records, self-report, or verified through laboratory testing. So we can ask our students to sort of think through what are the advantages and disadvantages of each of these approaches. Which method is more likely to be subject to misclassification? Do we think that misclassification is likely to be differential or non-differential? This is really an outstanding activity to work through with students, particularly as you get towards the end of the semester, for them to sort of think back about how all of these pieces fit together. They've learned about study design, measures of frequency and association. They will have learned about effect measure modification, the different types of systematic error, as well as random error. And all of that stuff is so important as we sort of think critically and holistically about a given study or a given result that we see. And this allows them to sort of look back and put all of those pieces together. So these were just a handful of examples about how Kristin and I really strive to engage new learners of epidemiology. And our hope is that regardless of what their ultimate career path is, that they are able to use the foundational tools that epidemiology provides as this set of critical thinking skills that can help them be, members of society who can really critically evaluate what it is that they're seeing and whether they're going to change their health behaviors about it, what additional questions they might have, and sort of move along from there and think about how they're applicable to their daily lives. So we will stop there. We are grateful for your time and happy to take any questions that you might have.
Thank you, Lauren. Thank you, Kristin, for the presentation. And as Lauren said, we'll be taking questions. So if you haven't already, please send through the Q&A box or the chat boxes. I would like to start with one question we had pre-webinar, which was from a registrant. So Lauren and Kristin, could you give any tips or tricks related to early undergraduate students who are disengaged and may have poor math skills? What can you tell those instructors about how to, I guess, work through those things with students?
That's a great question. I think, unfortunately, some students come to our classes with a little bit of a fear of math, or maybe not, as robust preparation as we might like. And I think there are a few ways that we can think about this. The first is to explain to them that the math that we use in these courses really isn't all that complicated. It's primarily division and subtraction. There's some multiplication that happens along the way. But it's, really sort of basics there. And so that may be helpful for students. There are lots of great resources that are online. The Rollins School of Public Health has recently developed some tools for students who have matriculated with us to provide some support. And in doing that, we have drawn on outstanding YouTube videos that are available to explain the basics of algebra and fractions. And so you may look to some of those resources and provide them to your students at the beginning of the semester. I think one other thing that I think about is how, in calculating a risk, for example, we can really, in explaining to our students the concept of risk, what it is that we are trying to measure here. We have a whole group of individuals, and we want to know among those, how many of them or what proportion develops a particular health outcome during a follow-up period. We can sort of use that description of words to go back and construct the formula for the risk, or think about how to put together what it is that we're looking for. So it is a challenge, but we do think there are lots of resources. I don't know if there's anything you would add to that one, Kristin.
I really like your last point a lot. I think, one thing we say in our classes is very often we're taking what we said in words and we're turning it into math. So there is a way, I think, to frame what ultimately is quite simple math, primarily division and subtraction, in a more intuitive way.
Mm-hmm.
Something that Lauren consistently does in her classes, and this is something I've kind of adopted from her, is she is also very, very good about, when there are calculations or formula on a slide, let's say, or instruction, materials, she will always write out every single intermediate step in the math. And it could be at the end of class after they've seen this risk or risk ratio calculation, 100 times, it's still there for them. And I think, that can be very helpful for students who are, maybe a little uncomfortable, when it comes to those sorts of calculations.
Yeah, I think it's helpful for when the math doesn't sort of just
Appear.
Yeah.
Great, thank you. We have a one that came through the Q&A box. What assignments do you provide your students? Can you give some examples of things that you think are engaging but also helpful?
Yeah, so I guess the way that we've structured our course Fundamentals of Epidemiology that we're teaching this semester, our assignments are sort of scaffolded. So the students learn the content each week, and then at the end of the week, they have a brief check your understanding quiz. So this is maybe at most 5 questions. They are closed-ended, so Canvas is able to auto grade those for us. The students get their grades right away and feedback about their responses. And that is just the very basics. What was sort of the ground floor of what we wanted to make sure that you understood during this session. And then that's followed up with a homework assignment that's a problem set where they're doing some more application. And this, I think, is really helpful to help build their confidence. They've had that check your understanding quiz that they worked on first. They get 2 opportunities to complete it, which I think also takes off some of the pressure. It puts them in a good position to do more of that application work. And those assignments that we use are often based on a published manuscript. Find some topic that is likely to be of interest to our students, and then use that example throughout the whole assignment. So they might be, calculating different measures and things and reflecting on, types of bias or wherever we are. That's the kind of thing we do. Kristin, do you want to say a little bit about the extra credit assignment that you've developed? I think that's really a great one.
Yeah, so I will often near the end of the semester give an extra credit assignment, which is basically asking them to read a, not necessarily basic, maybe, intermediate kind of level journal article, from a that's gone through peer review. And then the assignment is essentially integrating the various concepts that they've learned. So starting with, what's the hypothesis? What's the source population? What's the study design? What are the measures of frequency association? Which sources of bias are you concerned about, right? So integrating all of the things they've learned over the semester. But the thing that I think is very exciting about this kind of assignment, which is quite, simple, is that you can really underscore with them that they can read a peer-reviewed article, a peer-reviewed journal article, something that, probably couldn't or wouldn't even think to tackle at the beginning of the semester. And, it's an exciting opportunity to really underscore how much they've learned to be able to, read an article and read it critically.
Yeah, I think that is great. I mean, we have a lot of undergraduate students, fairly early in their careers coming into our courses, and being able to leave that course, feeling much more confident about their ability to read the peer-reviewed literature is really great.
Yeah. And many of these students are pre-med.
Yes.
Whether they, go to med school or not. Many come in pre-med, and I'm sure that's similar for many of us. And being able to read the literature, even if they don't go on to, become epidemiologists, is just, absolutely critical for them. So it's a great, and I think it leaves them with a really good feeling about what they've learned.
Yeah.
Thank you. We have a follow-up to that one. Do students work independently or assignments, or, for their work or these assignments, or do they work in groups?
So we generally allow them to, work together on homeworks. come to our office hours, TA office hours. We want the homework and check your understanding, those types of assignments to be, opportunities to talk with us, with others, and to really understand the concepts. Where I think both Lauren and I and most instructors at Emory ask students to work independently is on exams.
Mhm. That's right.
Great. We have another Q&A question. Have you incorporated Top Hat or other outside interactive programs into your course? And if yes, what is your experience with them?
So not used that one in particular. In the past, I have used Poll Everywhere, which I think works really great for in-person courses. When Emory went online, as everyone did in 2020. We actually found that this course worked well online, and we've stayed teaching it online, and it's made it more accessible to students who aren't on our main campus but are on the Oxford campus. That's a little bit further away. And so using the sort of what's already built into Zoom, I think has been really helpful for us. There is one online tool that I think is really great for new learners of epidemiology. Kristen and I wait to introduce it until about midway through the semester. But if you haven't used OpenEpi, this is a really outstanding tool that students can use to enter data to do some simple analyses and sort of check their work. And that's been really great for students to work through, but we always wait to introduce it until a little bit later once they've had a chance to really wrap their mind around those formulas, understand what they're trying to do, so that they're not just plugging and chugging and relying on what they see without really pausing to think about it. Have you used anything else, Kristen?
I haven't been. But I think it's important what you've said. I mean, I think it kind of goes against some of our students' nature to get out a pencil and a piece of paper and like actually write down, draw a 2x2 table, write out the risk calculation, who's in the numerator, who's in the denominator. But we really encourage that and provide time for that, especially in the beginning part of the semester, where we say, hey, today's gonna be a working day, so get out a sheet of paper and let's actually do it. And then later in the semester, you providing the OpenEpi tool, those kinds of things, where we we do try to frame it more as checking your work, versus, as Lauren said, I mean, you could just plug in numbers and it will give you the right answer, but we don't want to start there.
Yeah, and they're not ready for it often because OpenEpi produces output for both risk-based and sort of odds ratio type information. And so when you enter 2x2 data, that could be from a cohort design, that could be from a case control design, but you have to know which measures you need, otherwise you're going to be reporting the wrong thing. So they need some more sort of background there in order to be able to use that tool appropriately.
Great. Any other questions? Please feel free to put them in the chat. I have one question, and this leads into our next slide, but what concepts, do new learners struggle with? And maybe you can go into how that informed your decision to want to write a textbook.
It's a great question. I think, one of the more difficult concepts that we teach, the big kind of umbrella topic, is bias. Whether that be confounding information bias or selection bias, that we teach in the kind of fundamental class. But what's really interesting, and I mean, I observe this every semester and have over the past, 10, 12 years. Students come with some, even though they don't have the vocabulary for it yet, they have some intuition about bias, especially confounding. They have some intuition about why randomization is, you know, a good thing, you know, what randomization is doing for us. Or they, you know, they'll even early in the semester, they'll talk about making unfair comparisons, right? Because it's all about compared to what? Comparing one group to another. And so they have some intuition that I think we can use, you know, we can draw upon that to help guide them through what is often, you know, a kind of challenging topic.
Yeah, I would agree. I also think they, you know, a little bit more specifically, really struggle with this difference between effect measure modification and confounding. And in part because, you know, stratified analysis is a tool that can be used to sort of think about or begin to assess both of them. And then it becomes confusing. Also, we've got this third variable in there. And, you know, one of the things that I've found over the years is it lands much better if students can learn about effect measure modification first. It's often taught much later after bias. And, you know, I think it works well to teach it beforehand. Immediately after students have learned about study design, you can say to them, all right, up to this point, we have assumed that our exposure has the same effect on everyone in our study population. But what if that weren't the case? What if the exposure operated differently in different groups of people? And that's where effect measure modification comes in. And then we can sort of clearly separate that. It's not an error. It's just our exposure, you know, has a different effect in different groups. And then we can separate that from confounding, which can come a little bit later. And we didn't see anybody teaching it that way. There are a lot of things also, you know, David, that we saw that others, you know, weren't yet doing, but that was something that was, I think, really important to us to try and highlight. You know, what if we thought about effect measure modification first? We think that would be helpful. So that's what we did.
Great, thank you. I think we can go to the next slide. So this is all the time we have for today, but please visit us at www.springerpub.com/thinkepi to request a copy of this new textbook or for purchase, and you can use the QR code to save 25%, webinar 24. And we thank Lauren and Kristin again for all their knowledge and doing this webinar and taking your questions. And please feel free to send us questions after this webinar is finished through the survey, or you can get in touch with us on the next slide, and you can email springerpub.com at marketing@springerpub.com. So thank you for watching. Appreciate it.